Hello friends, welcome back to Mighty Microbe channel. Today we are back with the topic that is chemotherapy and different routes of drug administration. So, firstly, what is chemotherapy? So, it is the treatment of diseases by the use of chemical substance and it is used for the treatment of cancer. So, the next is route of drug administration. So, route of drug administration, it is the path which is chosen by the drug to travel in our body. We can say it as a route of drug administration. Fine. So the route may be as oral, then topical, parenteral. Fine. So in enteral route, the subtype is oral, then sublingual and rectum. And in parenteral, there are two types, that is inhalation and ingestion. And in topical, where we can apply it on the skin, say suppose as cream or ointment, it is classified as topical, that is local. Definition, it is given about the route of drug administration, that is the path which is taken by the drug to enter in our body. We can call it as route of drug administration. So the first type is enteral route, that is oral route. So it is classified into three, that is oral, sublingual and rectum. So this oral route, it enters through the alimentary canal, fine, which is taken orally from the mouth. The first one is oral route. So this route, it is a common route of drug administration and which is used for the neutral drug. Fine. So which may be as suppose you are having stomach infection or else throat infection, we can take it is known as a neutral drug. So we are taking it from our mouth and it may be in the form of tablet, capsule or serum or else powder. Fine. So it is cheaper and it is safe also. And the disadvantage is that less amount of drug it reaches to the target tissues and it also may cause gastric irritation. So these are the disadvantages of oral route. Then the next one is sublingual. So the sublingual, it involves by placing tablet under our tongue. This route, it is mainly used or it should be lipid soluble. This drug, it should be a lipid soluble, and the advantages are that the drug, it is easily dissolved and rapid absorption takes place. And the disadvantage is that it may be inconvenient and also this person may swallow the drug. So the last type of this enteral route is rectal route, where drug is in the form of solid or liquid form such as enema, and this is used for old patients. But this route, it is not acceptable by the patient. Why this route is used? To avoid the vomiting, and one more disadvantage is that this route, it may be irritating too. Is parenteral route. So this parenteral drug administration, it refers to the drug which is given by the route other than digestive tract. And the term parenteral, it is usually used for the drug which is given by ingestion or inhalation. So this inhalation, it is classified into drug, dry powder and uses of gases. The term inhalation itself gives the meaning that through the inhaler, the drug may be given through the inhaler. So the drug, the first one is drug. It may be given through the dose aerosols, that is salbutamol. Then the next is dry powder. It is given through the through inhaler. Example is the same, that is salbutamol. And the next is uses of gases. So various types of gases it is used. In general we can say about anesthetics. So this method it is easy and the side effects are minimum. So the disadvantage is that it requires specific apparatus. So for inhaler specific apparatus it is used, so this it is a disadvantage of this inhalation. And irritation of respiratory tract may take place. So the next one is ingestion. So ingestion, in ingestion there are various types through which the injection can be given to the patient. So the first is subcutaneous. This route might be used for arms, forearms, thighs. Example is insulin, where the absorption it is slow and it is hygienic, but the disadvantage is that absorption may be limited by the blood flow. Fine. Route. So this route it may be through thighs, and the absorption it is rapid as compared to the subcutaneous route. So it is also having a disadvantages that this route may cause nerve or vein damage. Fine. So the next one is intravenous injection. So this may be applied to cephalic veins or basilic veins, and here also absorption is not required, and this route it is used in emergency situation. Fine. It is also having a disadvantage that it might be more risky. So there are also following routes of administration. So one important is jet injection. So this method it is a needleless and it is a subcutaneously done by applying pressure over the skin. So this method jet injection it is used for insulin. The patient, those who are suffering from the diabetic, this method it is preferred. Fine. Last route that is topical route. So here the drug it is applied to the external skin, that is external surface skin and mucous membrane. So this topical route that is it is locally applied. So it is classified into an epidermic, insufflation, instillation, irrigation and swabbing. So in an epidermic route the drug it is applied to the outer skin. It is called as an epidermic route of drug administration. We can give the example of cream, where the cream it is applied to the outer skin. Fine. The next one is epidermic route. Here the drug it is rubbed on the skin. It is known as epidermic route. Example is different oils. So the next is insufflation. So here the drug is in the finely powder form and it is all into the body cavity with specific nebulizer, and this method it is known as insufflation. Fine. So the next is instillation, where the liquid it is poured into the body by dropper into a conjunctival sac or ear, nose and wounds. The next is irrigation. This method it is used for washing the cavity. Example is urinary bladder, vagina, uterus. And the last one is painting, that is swabbing, where the drug it is applied in the form of lotion on the cutaneous or mucosal surface of buccal or nasal cavity. So these were the three types of route of drug administration. So if you are having any query, please message. Thank you.